right, so how are your allergies? Because spring means blooming trees, budding flowers, and if you're one of the millions who suffer from seasonal allergies, it also means sneezing, runny nose, and congestion.
Oh, because the weather has been cool and wet, the peak of allergy season is expected to actually boom in the next couple of weeks. But the good news is you can fight back. Here with some tips on how to manage seasonal allergies, Dr. Jamie Kiehm. She's an allergist and immunologist with ENTA and Allergy Associates right here in Manhattan.
Hi,
Doc,
guys.
thanks for being with us.
Thank you for having me.
So first, Rosanna and I at the top of the show, we were both saying we haven't had any kind of symptoms. A few minutes ago, she starts sneezing.
I know, I'm cough-right. I'm like,
Exactly. But we were wondering, is it not so bad because of all the rain we've had?
Yeah, I think because it's been cool and rainy recently, it's kind of tampered the pollen levels down a little bit. But I have a feeling that as it warms up and dries up later this week and within the next couple of weeks, the pollen levels will rise again and you'll start feeling more of your symptoms, sneezing more and things like that.
all right, so let's talk about allergy symptoms and what you can do to kind of maybe, you know, cut back a little bit on that.
Right.
Yeah, the typical allergy symptoms are like stuffy nose, itchy, watery, red eyes, sneezing, having postnasal drip, things like that. I typically tell my patients there are 3 ways to treat allergies. The first way, of course, is avoidance. So in the pollen...
Stay indoors?
How do we do that,
How do you
Dr.
avoid
Kiehm?
exposure?
Just, you know, actually the higher pollen counts are in the morning, so if you can avoid going outside in the mornings, that's a little bit better. But
Okay.
I usually tell people to kind of protect their home. So keeping your windows closed at home so the pollen doesn't come inside your house. When you come home at the end of the day, changing your clothes, showering before you go to sleep, because all the pollen from the day is sticking to you, then you're getting it all over your house. Wearing sunglasses when you go outside can also protect your eyes from the pollen too.
And we talk about medication also as a second defense.
Yeah, so this medication is the second way, and so there are a lot of over-the-counter medications for allergies, the allergy pills, nose sprays, eye drops, and you know, you can ask your pharmacist for help, but if you get confused or you don't feel like it's working for you, you can go to your allergist. They can help kind of tailor a good regimen for medications for you.
What do you think about those allergy shots? Are they worth it?
I think allergy shots are worth it. I think it depends on the patient. I would say most patients get significant relief from the allergy shots, but it's a long commitment.
And is it a risk? Is there any risk to taking those injections?
Most people tolerate them pretty well, but the biggest risk is, of course, having an allergic reaction. It's rare, but it can happen. But if you take the shots at an allergist's office, and so the allergist and the staff there know how to treat you if something were to happen.
But you can also kind of have your own home remedies, right?
Yeah.
Things that you can do right there. You don't have to go to medication and complicate, right? Like you stay indoors when possible, which we touched on.
You can even do like nasal rinses if you don't like doing medications or things like that. They have like the nasal sinus.
Neti pot?
Yeah, like the neti pot. Like that's just salt water. So if you, again, don't like medications, that's kind of a benign way of treating some of your
The other thing
allergies.
I saw one of your recommendations was wash your, take a shower before bed, because you're going to put all that pollen on your bed and bed sheets. And you say make sure you wash your bedding at least once a week.
Yes, because you don't want to be sleeping in what you're allergic to. That means you're going to wake up with all of your symptoms again. So yeah, just protecting your house is usually what I tell my patients.
So typically, when is the peak span? For people who are seasonal.
Right. So it depends on what you are allergic to. So that's why it's kind of nice to see an allergist so they can test you so you know which seasons that you might have more symptoms. But typically, trees are the springtime, grass is the summer, and weeds are the fall. And then if you have dust mite allergy, that can be a year-round allergy too.
Oh, it's always something.
You can be allergic to all sorts of things.
Can you outgrow it? Because all of a sudden I'm thinking, well, maybe I'm not going to get my allergies this year because I haven't, had a problem.
I think allergies can change as you grow older. Some people get worse, some people get better. It's hard to predict who that person will be. And then some people, their seasons get worse or better as the years go on too.
When you were talking about the medication, sometimes you go to the drugstore and you see medication that says it can do so many things. Should you try to just be simplistic and just get something that really is tailor-made to whatever your symptoms are?
Yeah, certain things help certain symptoms, like more for the sneezing and itchy eyes type symptoms, the allergy pills might help the best. But if you have more congestion and like post-nasal drip, the nose sprays may help you better. But that's like speaking to your doctor, your allergist may help with doing that for you.
Dr. Kiehm, how can people find you?
I am at ENTA and Allergy Associates. Our office is close to Grand Central, so you can visit the webpage, make an appointment, things like that.
All right. Great to have you on. Dr. Jamie Kiehm, appreciate it.
Thank you guys
and
so
all the
much.
tips.